There's so many things to be curious about in medicine. And we really agreed, I think, that curiosity is important to follow. It's important. So one of the questions maybe you had was, what do track marks look like? Like train tracks, track marks on the arms. And they can be very extensive. So our case yesterday, he said, no, I don't have any IV drug use, yet examples on his arm. And then any infection in the bloodstream, it's usually, does anyone know, I should ask, what bugs, what organism?
Staphylococcus aureus.
Yes,
Yeah.
excellent. So because of this infection here, very difficult to treat infection, do you think you have to treat with antibiotics short time or a long time?
Have to use long term.
It's about 6 to 8 weeks of IV antibiotics to treat. Okay, let's move forward with the cases, and we'll have the first group come on up and begin.
Our patient is a 56-year-old man who came in with a chief complaint of intermittent headaches for the past 2 months.
History of hypertension and hypercholesterolemia. Smoked a pack of cigarettes a day, almost 40 years.
Let's move on to diagnostic schema. Here is a differential diagnosis for headache. Tension headache or migraine, brain tumor, cerebral hemorrhage, and hypertensive organ damage are considered.
Final diagnosis is uncontrolled hypertension with hypertensive end organ damage. Treatments are lifestyle modification. Finally, early treatment is necessary because hypertension can lead to various organ damage. Thank you for listening.
Excellent. Wonderful job. Very well organized presentation and very streamlined and focused. Excellent. Questions for a group. What are you curious about?
Like, should be hospitalized immediately or just stay at the house?
Oh, excellent question. What is your management strategy for this patient? Do they need to come to the hospital immediately? Could you take care of them in the outpatient setting?
We think we should treat him at a house.
So,
At home.
and how would you, I'm going to follow up, how would you manage over time?
2 or 3 weeks later.
Yeah, 2 or 3 days is a great answer, right? So you start a medication and you want to see how it's going. Sometimes we give people blood pressure cuffs at home. They give you, take this home, please.
Why does hypercholesterolemia make arteriosclerosis more likely?
Causing narrowing and less of.
No, so hypertension may be damaging, right? And then high cholesterol sets up plaques, right? Plaques. We say plaques in the walls of the vessels that damage.
Which organs are particularly affected by hypertension?
Yeah, which organ?
Kidney or
Kidney?
heart and brain.
Yeah.
What are the most important lifestyle modification for this patient?
Let's give him a round of applause. He's asking about prevention. And we don't talk about lifestyle because we're so busy. But it's maybe the most important conversation we will have with our patients.
Smoking cessation, weight loss, alcohol moderation, reduced salt intake.
Yes, and stress reduction. Maybe I would add stress reduction. And it's alcohol. And anyone know how alcohol and blood pressure interact?
Raise.
Yes, increases. Excellent. Okay. So very important question. Excellent.
In this case, central nervous system, psychogenic and cardiovascular causes Furthermore, the dizziness was not persistent and was related to positional changes, which also argues against central etiology such as cerebellar stroke or multiple sclerosis.
Questions about this case? Yes. Let's
What type of BPPV is most likely in this case?
I think posterior canal BPPV. This is because this patient has dizziness when they're looking down or lying down, which is typically involved the posterior semi.
Why did her nausea relieve after the first episode?
Benign positional vertigo or paroxysmal vertigo. Benign means what?
Good situation. Not bad. Not bad.
Yeah, it's not too concerning. And then positional, what's position?
Lay down.
Yeah, lay down or stand up. Either way, your position changes. So benign, positional, paroxysmal. What's paroxysmal? It's a hard word.
Treatment?
Oh, good answer, but no.
No.
Yeah. Thank you for making a mistake. That's wonderful. Suddenly, and then vertigo. Suddenly the room spins. So the name tells you what the disease is. Do you have your answer?
In this case, the ear stone changed the position, and so the eyes and body do not perceive the same position. So,
The small crystals that are stuck in the vestibular apparatus. But yes, great, wonderful. Well, thank you very much for this group. We have
And chronic episode of right-headedness, complete AV block, bradycardia.
This is specific problem list. Sudden syncope, bradycardia, heart rate 35 BPM, chronic lighthead.
He requires permanent pacemaker implantation to prevent recurrent episode and sudden cardiac death. Thank you for listening.
excellent.
What should we be careful about when putting a pacemaker in an elderly person?
Good question. In an elderly person who gets a pacemaker, what do we have to be careful about?
Older people have skin weak and have higher risk of infection.
Infection risk.
It is important to keep the wounds clean. Skin, scratches clean.
Keep that skin clean.
Yes. Okay.
Okay. Infection for sure. Excellent.
What is the pathophysiological mechanism behind syncope in complete AV block?
What is the pathological mechanism behind syncope?
AV block is caused by lack of conduction from the atria. So heartbeat is getting slow and cerebral blood flow is reduced. They make syncope, I think.
Excellent answer.
I was curious about the
Oh.
long-term consequence when AV block was untreated.
If complete AV block is left untreated, it can lead to severe bradycardia. It may cause recurrent syncope and heart failure or sudden death.
Excellent job. Everyone, thank you so much. I know we're over. I appreciate you all so much. Thank you. Excellent job. If anyone has questions about cases tomorrow, I'm happy to stay.